So here's the female hemipelvis along with the female organs. Here's the other side. So we'll go over the muscles first. We have the obturator internus. We have just inferior to that the coccygeus muscle, which is part of the pelvic diaphragm, along with the levator ani muscles. So we have the iliococcygeus, pubococcygeus, puborectalis here. Next we have our perineal muscles. This is part of the diaphragm here. So we have the ischiocavernosus here, bulbospongiosus comes down, the superficial transverse perineum, and the deep transverse perineum. Lastly, we have the external anal sphincter, and that is all we need to know for the muscles of the female hemipelvis. Next, we will discuss the nerves. So we have the lumbosacral trunk coming down from the lumbar region. We have our sciatic nerve here. Travels just next to the piriformis under the greater sciatic notch, which is just right here. Next, we have our pudendal nerve, which is going to travel through as well and come back here posteriorly, which is where I think he will tag it, right there. Pudendal nerve will branch off into the inferior rectal nerve and the perineal nerve, which you will also, perineal nerve will most likely be tagged here on the perineal muscles. See on this side. We have the sacral plexus, which is going to be just this plexus of nerves here, and the cauda equina, also known as the horse's tail. As for arteries, we have our common iliac right here. It's just right before it branches into the external artery, external iliac artery, internal iliac artery. So we'll go in order here. Right here we have our obturator artery. It is just superior to the obturator muscle, obturator internus muscle. Then we have our umbilical artery. We have our superior vesical artery, uterine or vaginal artery, so this is female only, and middle rectal artery. Just next to that we have our internal pudendal nerve. Just under the sciatic nerve, I'm sorry, that's artery. Just under the sciatic nerve we have the inferior gluteal. So think it's going towards the back. So I think of it going to the gluteal, and it's the inferior of the two gluteals. So here, up here is our superior gluteal. So think these two are going towards the back. So they're gluteal. This one's up superior, so superior gluteal, inferior gluteal. Just off the internal iliac is going to be the iliolumbar artery and the lateral sacral artery. We have our ligaments. So first we have our anterior longitudinal ligament is going to travel up the anterior aspect of the spine. Our anterior sacroiliac ligament is going to just attach the ilium to the sacrum anteriorly. So it kind of comes across, and it's deep to the iliolumbar. So iliolumbar sits on top of the anterior sacral. Posterior sacroiliac is going to be these ligaments here. Oh, my hand was blocking right here. Sacrospinous is going to attach the sacrum to the iliac spine, so it's going to kind of come across. You see the pudendal nerve kind of coming over it. So sacrospinous comes across here. And And then we have sacrotuberous is going to also be from the sacrum to the ischiotuberosity. So it's the big one that stretches across right here. We have the inguinal ligament associated with the inguinal canal. That's just going to attach from the ASIS down to the pubic tubercle. Last one we have for ligaments is the anococcygeal, and that will actually be found on here where this muscle is. Anococcygeal, because we have our anal region up here, come down, attached to the coccyx, which so would be oriented this way. So that white right there. As for the female reproductive and urogenital organs, we have here's our bladder. We have our round ligament of the uterus. If we look here, we have our ovaries covered by the fimbriae, the fallopian tube down here, right next to the ligament. We can open up now, and we will see our uterus, our cervix, which is just that opening when the uterus turns into the vaginal canal, our vagina. The urethral orifice is going to be here. We have our clitoris is going to be found right here, kind of on the muscle part of the model. Right there, these two. You'll also see the vestibular gland, vestibular bulb. And that is it for female hemipelvis.